Good afternoon and welcome to the Assembly Committee on Health and Human Services. Secretary, will you please call roll?
Assembly members Dahlia. Edgeworth. Gonzalez. Goulding. Gray. Hafen. Hibbets. Hunt. Jackson. Koenig. Nadeem. Wen. Ortlicker. Chair Brown-May.
I am here. Thank you so much for that. Would you please mark Assemblymember Gray present when he arrives? With that, I would like to welcome everyone here in our audience in Carson City to this afternoon's meeting, everyone in Las Vegas, and anyone who may be joining us online. A couple of housekeeping items as we get started today. Please silence your electronic devices. If you wish to testify, please sign in at the table by the door and provide a business card. When testifying, please remember to turn on your microphone and clearly state and spell your name for the record, and then turn off your microphone when you're done speaking. Electronic copies of any of your handouts should have been submitted to the day prior to our committee manager. Members of the public are always welcome to call in to provide testimony on a bill. You can do that in person or by telephone. You're welcome to call 888-475-4499, and then when prompted, provide the meeting ID, which is 864-2005-4278, and then press pound. Our meeting agenda and committee information is available on Nellis, which can be accessed through the legislature's website. You may also watch our meetings there and on the YouTube channel. Public comment will be taken today at the end of this meeting, and each person will be limited to 2 minutes. And please remember that we expect courtesy and respect in all of our interactions. And note that committee members may be using their laptops or other electronic devices. Please do not view this as a sign of disrespect, as they are viewing handouts for the committee documents today. On our agenda today, we have 2 bill hearings, and we will start with Assembly Bill 31. So I will now open the hearing on Assembly Bill 31, and welcome up to the table Assemblymember Hafen, Dr. Austin Gardner, and Mr. Funkhauser. Please, you may begin when you are ready.
Good afternoon, Madam Chair, committee members. Thank you so very much. For the record, I am Gregory Hafen II. I represent Assembly District 36, which surprisingly includes Clark, Lincoln, and Nye County. And I kid you, Lincoln County is like this big, so I always have to remember that I represent Lincoln County. I love those guys over there. It is with my pleasure to introduce Assembly Bill 31, which provides Medicaid reimbursement for certain non-emergency behavioral health transport services. And I know most of you were on the floor earlier when I mentioned this bill came from the Southern Nevada Rural Regional Behavioral Health Board as their one BDR. It has been an absolute honor to serve on this board. Even though I voted against the creation of the board, it has become one of my all-time favorite boards to serve on. The members that are here presenting with me, as well as the other board members, have taught me so much in the behavioral health spectrum that I didn't know before, and how much need is actually out there. And so here with me from the Southern Regional Behavioral Health Policy Board is Mark Funkhauser, and then appearing in Vegas is Dr. Kevin Austin Garner. Mr. Funkhauser is our committee director. He spent 25 years working with courts, including national programs in the community, from various fields of child welfare to juvenile justice. And 20, 30 years he's been doing this. And we've now had the privilege of working with him. Dr. Austin Garner is a psychologist with substantial experience in providing medically underserved areas of the population. He is currently licensed in Nevada, Illinois, British Columbia, and Canada. I did want to note that the comprehensive behavioral health services that he focuses on is with opioid use disorder, which a number of us got to sit through a presentation this morning in Ways and Means on the funding of that. But we're not here to talk about money, right, Madam Chair? Thank you. I will now go ahead and turn the presentation over to Dr. Austin Garner and Mark Funkhauser.
My name's Mark Funkhauser, and I am the Southern Regional Behavioral Health Coordinator. As such, I am a nonpartisan facilitator of the Southern Regional Behavioral Health Policy Board. In that role, I am only presenting the bill on behalf of the board and not advocating for its passage. With me today is Dr. Kevin Ostergarner, the chair of the board. I'm here to answer any questions and also to bring to your attention the one-page overview that was submitted previously on AB 31. And Dr. Austin Garner, the chair of the policy board, has a presentation and testimony.
Thank you, Mark. My name is Kevin Austin Garner, KEVINOSTEN-GARNER. Chairperson Brown May and members of the Assembly, thank you for the opportunity to testify today. I'm a psychologist by trade and am the chair of the Southern Regional Behavioral Health Policy Board. I am honored to represent the board as we present AB 31, a bill designed to enhance behavioral health transportation services, particularly in rural and frontier communities across Nevada. This bill represents 2 years of hard work by the volunteers, coordinator, and minority leader Hafen of the board in their dedication to improving the health and resiliency of their neighbors and communities. I am proud of and grateful to each of them for their dedication and service. This legislation is critical to addressing one of the most pressing challenges in Nevada's behavioral health system: safe, timely, and appropriate transportation for individuals in crisis without unnecessarily burdening our first responders. Looks like the slides are not up, so I will just continue going. If you can go follow on, this will be slide 2. Nevada faces significant gaps in the behavioral health transportation, particularly in rural and tribal areas, where long distances and workforce shortages create barriers to care, especially in a crisis. Currently, law enforcement and EMS serve as the primary transport providers for individuals in behavioral health crises. This reliance is problematic for several reasons. First, police and EMS spend hours, full or multiple shifts, transporting individuals across counties instead of remaining in their jurisdictions and responding to medical emergencies or crimes. Second, the long transportation drives and wait times at emergency rooms can pull volunteer responders from their jobs and income for a day's time or more. Third, transporting individuals to an appropriate facility often means long drives and long waits for paid emergency responders, creating budget strains with overtime pay. Fourth, handcuffing individuals in crisis and transporting them in patrol cars contributes to stigma, fear, and trauma, making future engagement with the healthcare system more difficult in future crises. Fifth, sheriff's departments across the country, including in Nevada, have voiced their support for non-law enforcement alternatives for behavioral health transport. The third slide. AB 31 provides a solution by creating a sustainable reimbursement structure for non-emergency secure behavioral health transport. Specifically, the bill will increase Medicaid reimbursement rates by 15% for rural counties and 10% statewide to incentivize private providers to offer these services. Second, currently Medicaid only reimburses transport when a patient is in the vehicle. AB 31 allows empty miles to be reimbursed, ensuring providers are compensated for their full trip. Third, AB 31 frees up law enforcement, EMS, and emergency vehicles and equipment to remain in their local communities to focus on their primary public safety and medical emergency response duties. Finally, AB 31 creates trauma-informed transportation by ensuring trained mental health professionals transport individuals in behavioral health emergencies, aligning Nevada with national best practices. Patients begin receiving trauma-informed treatment from the point of pickup straight through their care destination. Next slide, please. The current fiscal note estimates an increase in Medicaid costs of $1.26 million in FY 26 through 27. However, this does not account for the substantial cost savings that AB 31 will generate by reducing reliance on law enforcement and EMS support. Research from other states show that law enforcement agencies spend an average of 10% of their budgets on behavioral health transport. In 2017, U.S. law enforcement spent $918 million nationwide transporting behavioral health patients. 21% of law enforcement staff time is dedicated to transporting individuals in mental health crises. This diverts personnel and resources from preventing crime and responding to medical emergencies. Nevada EMS and ambulance services experience similar burdens. Studies indicate that alternative transport models reduce ER visits and EMS utilization, leading to significant cost savings. Next slide. AB 31 is not just about funding. It is about efficiency, public safety, growing private-public partnerships, and trauma-informed best practices. AB 31 can free up law enforcement and EMS to remain in their communities to respond to medical emergencies and crime, ensure people in crisis receive trauma-informed care they need at the start of the encounter through their entry point into a healthcare facility, and save taxpayer dollars by shifting from costly emergency response to more sustainable private-public partnership solutions. Nevada can lead the way in behavioral health reform, just as states like North Carolina and Oregon have done with successful alternative transport models. I urge this committee to support AB 31 to create a more effective, cost-efficient, and trauma-informed behavioral health system for all Nevadans. Thank you, and I welcome any questions you have.
Thank you, Madam Chair. Gregory Hafen for the record. If I could, I just wanted to touch on the presentation real quick and put it in perspective for each of you. We all drive back and forth to Las Vegas, Assemblyman Gray probably very frequently, but the rest of us coming up here to Carson City. And under the current law, and I'm going to use Tonopah as an example, they have one ambulance in the entire community. And if there's an emergency for behavioral health where they have to transport that individual, they're transporting that individual either out of state to Reno or to Las Vegas because that's where the facilities are to help them. That ambulance is now taken out of service for an entire day, not only for staff, but heaven forbid any of us are to get in a car accident while driving, or anybody else in the state. And so to me, when this board brought this to my attention, it made me frankly a little nervous that we were, as a state, not providing the services to the community that are needed. And this, I believe, is the most cost-effective manner of addressing the issue and solving the problem that I hope never affects any of us. And so thank you, Madam Chair. I know that we are here for questions.
Thank you. I think we're going to start with Assemblymember Orrin Lichter.
Thank you, Chair. Thank you for bringing this bill. I share your concern for the problem, and this sounds like a good fix. I just have a question about the terms, and this may have to do with statutory definitions. On one hand, you describe the provider as non-emergency secure, and you've also said this is to be used in behavioral health crises, which sound like behavioral health emergencies. So is this just a term of art to hear emergency, needing for mental health emergencies, but non-emergency transport? Seems.
Thank you. Yeah, thank you for the question. Yes, the terminology.
If you'll please state your name, for the record.
I'm so sorry. This is Kevin Austin Garner. The nomenclature we pulled from both Oregon and North Dakota, and some of those were transposed. So yes, we are talking about behavioral health emergencies, So if somebody is in crisis, psychotic, suicidal, or just majorly depressed and needs to get into a hospital and the family doesn't feel safe for a child transporting them on their own. So when we're talking about the transport, though, the way it is framed as a non-emergency transport, but it is for an emergency. So that's the best I can clarify just based on the different models we were looking.
Thank you. Next up, we have Assemblymember Gray.
Thank you, Madam Chair. And mine is kind of along the same lines, and Assemblyman Hafen also kind of alluded to it. But are you guys, since it's, I mean, I get the terminology emergency, non-emergency. However, would you guys be looking at somebody doing this with a non-ambulance, or would it be an ambulance that you'd be taking out of service from another area? And would it be private transport or public transport? And I do like the idea because it will definitely save money in the long run and also keep resources in the community. But I am wondering about the whether it be emergency vehicle or non-emergency vehicle.
This is Chair Austin Garner. The models that we were looking at had equipped vans, so they were not ambulances. So they were van transportation that folks can't get out of, but it was in more of a comfort transportation. There would be a trained mental health worker with them so that they are able to provide that treatment in the van on the transport, but it would not be an ambulance. Now, if somebody needed a more intense intervention, like they needed to be strapped down to a gurney because they were uncontrolled, the initial transport service would then call that into 911 if it was something that they exceeded their capacity to handle based on their mental health presentation.
And Madam Chair, if I could add to that, Gregory Hafen for the record. I also want to mention that some of the transports are actually being done by law enforcement in their squad cars. And as Dr. Austin Gardner mentioned, when somebody's in a mental health crisis, being put in the back of a squad car to be transported is probably not the best solution for that individual, especially if they're stuck there for 4 to 6 hours. And so this is an alternative to that helps with, I'm not the doctor, so I probably shouldn't speak, but tends to lessen the degree of stigmatism and stress that goes along with being transported in the back of a squad car.
If I may, this is Chair Austin Garner. It can also exacerbate symptoms. If somebody is psychotic, they're put in the back of a police car. How they're blending reality and unreality could actually increase their symptoms and make the transport even more difficult.
Thank you guys so much. That was, yeah, and I agree with you, Assemblyman Hafen, wholly unacceptable to use a patrol car for a myriad of reasons. So thank you so much.
Thank you. I'm wondering if we could go to legal, if you would weigh in on with regard to the definitions that we're currently discussing in this bill.
Thank you, Chair. David Noss, LCB Legal for the record. As used in Section 1 and Section 3, non-emergency secure behavioral health transport services has the meaning ascribed to it in NRS 433.3317. And then when we go to NRS 433.3317, it defines non-emergency secure behavioral health transport services as the use of a motor vehicle other than an ambulance as defined in NRS 450B.040 or other emergency response vehicle that is specifically designed, equipped, and staffed to transport a person with a mental illness or other behavioral health condition in a manner that allows observation of the person being transported and prevents the person being transported from escaping from the vehicle or accessing the driver or the means of controlling the vehicle. Thank you, Chair.
Thank you. That's very helpful. Thank you. Next question we have from Assemblymember Goulding.
Thank you, Chair. Thanks for the good presentation. Could you build some context around what this would look like? Would this bill provide services to each of our rural and frontier counties? How many vehicles would be included? Is that one in each county? And where would you position them in our large counties? Even within a county, there's such a, huge area.
This is Chair Austin Garner. I think that's going to be a decision for you all to make in how that gets distributed out. There are models out in Oregon and North Dakota, again, and how they position it as a private company that they contract out to build the services out. This is going to be statewide. It's not just for rural and frontier. That is the focus of the region that we represent with our Behavioral Health Policy Board. But this would be something that is statewide. So I think that would have to be in partnership with HHS in looking at where is the need, how can they cover the miles, and where is the most pressing to roll it out in pilot projects would be my recommendation.
And Madam Chair, if I could add to that, Gregory Hafen II, Assemblyman from District 36. A lot of this will actually be done at the local level also. With the increase in the Medicaid reimbursement rate, it will allow the local, whether it's the fire EMS or the local ambulatory services, or even the private sector, to get a higher reimbursement rate and therefore be able to purchase additional equipment, vehicles, et cetera, for these sorts of transports. In addition, it allows for HHS to apply for another waiver, which we just had a great presentation where those waivers are going through at an expedited rate for those that don't sit on ways, which I was really happy to hear about. So now we're asking for another waiver under this to the federal government for that. But so it is a multifaceted where we'll be asking the federal government, obviously, for the increase in the Medicaid reimbursement rate, plus with the increased reimbursement rate, the local municipalities, fire, EMS, or even the private sector will be able to afford to purchase additional vehicles.
Thank you. Assemblymember Gray, you have one additional follow-up.
Thank you, Chair. On the staff, the trained staff, what are you looking at in the way of staff? Are you talking about a psychologist, or are you talking about a psych tech, or does it depend on the type of transport?
In both Oregon and North Dakota, they have different models.
Will you
So
state
I
your
think
name for
that
the
would be
record, please?
Oh, I'm so sorry. Chair Austin Garner. That they have different models of the level of practitioner. I think a master's level clinician would be sufficient. I think you could also, if Nevada, through our Be Here initiative on behavioral health workforce development, could also look at some sort of specialty training, a certificate, or other type of training that would train in crisis intervention and transport. And so that might be another initiative to consider for us to not just kind of pigeonhole it in our current licensees that we have, but is there a way that through our workforce development programs that are being developed, that perhaps this is another certificate or other type of specialty we could do that may not require all the credentialing you would need at a master's level clinician.
Madam Chair, I'll be very brief. I just wanted to clarify, this is Gregory Hafen II for the record, that we're not talking about changing who's doing the work. That's under current statute, under current law. We're not changing that in any way, shape, or form.
Thank you. Thank you for the presentation. I believe that's all the questions from our members. If you will step back at this time, we will now open up for those who are in support of Assembly Bill 31. If you are in support of Assembly Bill 31, please come forward to the testimony table here in Carson City. In Las Vegas, you're welcome to take a seat there. Thank you. You may begin when you are ready.
Good afternoon, Madam Chair. For the record, Ryan Beeman, representing the Professional Firefighters of Nevada, last name Beaman. We rise in support of this bill, AB 31. We want to say thank you to the committee for all their great work that they do. We do monitor the policies that come out of those different committees, and they do excellent work with the legislation. Just like it was already said, this will help out our rural areas, our rural departments, that with the transports that they currently have to do, and we support AB 31. Thank you.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record. Happy to be here in support of AB 31 today. We think that this is a really good bill to hopefully incentivize the non-emergent secure behavioral health transports from coming out into the rural counties and beginning these services. Thank you.
Thank you, Chair. Excuse me, Dan Musgrove, Strategies 360, here on behalf of a number of clients, but most importantly, Desert View Hospital in Pahrump, a critical access hospital. But I'm also a member of the Clark County Regional Behavioral Health Policy Board, as well as a member of the Clark County Children's Mental Health Consortium. And I can tell you that in the 26 years that I've been working on behavioral health issues in this building, that these kind of tools in the toolbox are so important, because you touched upon it a little bit in this hearing, but there are so many unintended costs that go along with the delay of treatment, the stigma that goes along with it, the impact on hospitals, critical access hospitals whose beds are limited, and for people that are suffering from a behavioral health crisis, that is not the best place for them to be. And so getting them into that place in a non-stigma method, in a safe method, preventing our first responders from taking time out away from their duties and away from their jurisdictions is very, very important. So we ask for your support of this bill.
Thank you. Is there anyone else in support of Assembly Bill 31 here in Carson City? Seeing no one, and no one in Las Vegas. AVH, is there anyone on the telephone line in support of Assembly Bill 31?
If you would like to testify in support of Assembly Bill 31, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 245, please press star 6 to unmute your phone. You may begin.
Good afternoon. For the record, this is Valerie Haskin, VALERIEHASKIN. I am the Rural Regional Behavioral Health Coordinator, and I am speaking on behalf of the Rural Regional Behavioral Health Policy Board, which supports this bill for all of the reasons that were mentioned during the presentation, particularly some of the comments given by Assemblyman Hafen. I wanted to add some additional context to this from other rural communities. I have had previous contact with private companies who have tried to set up these services in Nevada that were successful in other states. But unfortunately, they were not able to do so because of the combination of the higher cost of doing business in Nevada compared to their home states, in combination with the much lower Medicaid reimbursement rates for these services. So that being said, we do support this. This would be a huge public safety initiative for all of Nevada, and particularly our rural and frontier communities. Thank you.
Chair, there are no other callers to testify in support at this time.
Thank you. Now we'll move into opposition. Is there anyone here in opposition to Assembly Bill 31? Please come forward. Carson City. Las Vegas. Seeing no one moving. AVH, is there anyone on the phone lines in opposition to Assembly Bill 31?
Chair, the public line is open and working. There are no other callers at this time.
Thank you. At this time, we'll move into neutral testimony. Is anyone here to offer neutral testimony for Assembly Bill 31? No one moving in Carson City. Oh, yes, by all means. Thank you so much. Come forward. If you'll state your name and spell. You have 2 minutes. You may begin when you're ready.
Wendy Matson, WendyMadson. I am with Healthy Communities Coalition. We serve rural Lyon County, and we just would like to share we really see the need in our rural communities. It is a long distance from our communities to any healthcare services or hospitals. Not only the cost savings, our community is growing rapidly. Services and resources are slim. We would like those to go the appropriate places, and more importantly, the enhancement of the treatment for those that we're serving, particularly our youth and our young adults. We see this would be or neutral on the bill, but really see the need. So thank you.
Thank you. Is there anyone else here in Carson City and neutral on Assembly Bill 31? Seeing no one in Las Vegas, moving to the testimony table for neutral on Assembly Bill 31. AVH, is there anyone on the telephone line in neutral?
Chair, the public line is open and working. There are no callers to testify in neutral at this time.
Thank you. Would the bill presenters like to make any closing comments at this time?
Just want to say thank you very much, Madam Chair and the committee. Gregory Hafen, for the record, we greatly appreciate the time.
Thank you. We will now close the hearing on Assembly Bill 31. Okay, members, this time we will open the hearing on Assembly Bill 60. We are pleased to have with us the distinguished Senator Dr. Titus and a co-presenter, Sherilyn Rare-Wood, who will be joining us to present Assembly Bill 60. At this time, we'll open the hearing on Assembly Bill 60. Senator Dr. Titus, you can begin when you're ready.
Thank you very much, Chair Brown-May. I actually have two important people with me at this table. One is our policy person, which is Sherilyn Rare-Wood, and then we have the most important at this table, the expert on this issue is Daria Singer, and I'll turn this over to him in just a minute. So thank you, Chair, for allowing me to present to the members of the Committee on HHS here in the Assembly. For the record, I am Robin Titus. I represent Senate District 17. And for those of you who do not know what that district is, I represent all of Churchill County, all of Lyon County, all of Douglas County, all of Mineral County, all of Esmeralda County, and part of Nye County. So I have almost the whole western slope of Nevada. This bill is being presented on behalf of the Northern Regional Behavioral Health Policy Board. Here, as I mentioned, the tables, the chair is not here. She wasn't able to make it today, but the board member Daria Singer and Sherilyn Rare-Wood are here with me. So just for those who are new to the HHS committee and this process, a number of sessions ago, this body created the 5 distinct behavioral health boards to represent the unique areas of each of our state. So we have a Southern board, we have a Clark County board, we have a Washoe board, we have a rural board, and we are the Northern board. And so to that extent, each board has one bill that they are able to present. So Assembly Bill 60 was created by our board after months of meetings and deliberation, and it seeks to make changes to the language governing certified prevention specialist and peer recovery support specialist. So I'm going to turn this mic over to the people who are those specialists. Thank you very much.
Good afternoon, Chair Brown-May, Vice Chair Wynn, and distinguished members of the committee. My name is Sherilyn Rare-Wood, CHERYLYN, RAHR-WOOD. And I serve as the Behavioral Health Coordinator for the Northern Region, as well as the Northern Regional Behavioral Health Policy Board, one of the 5 boards that Senator Titus just so eloquently described. I would like to add that she has been major leader, voice, and advocate to all of us since the inception of these boards. That said, I must state I'm a nonpartisan facilitator of the Northern Regional Behavioral Health Policy Board. In that role, I am only presenting the bill on behalf of the board and not advocating for its passage. Soon I will hand the presentation over to Daria Singer, our executive member of the Northern Regional Behavioral Health Policy Board, as well as our subject matter expert that Titus explained so well. Before we get started on the presentation, I just want to take a moment to thank the committee for the opportunity, time, and space to present on Assembly Bill 60. We welcome any questions or comments you may have upon completion of this presentation. So this is just a list of the Northern Regional Policy Board members according to NRS 433.429. As you can see, a broad spectrum of professionals from all over the region that work in the fields affected by behavioral health and healthcare. And it has been and continues to be a privilege to be the coordinator for this board as well as the region that I serve. Speaking of that region, here's the Northern region: Carson City, Churchill, Douglas, Lyon, and Story, in no particular order. I love them all the same, but a great region. And once again, here's a map of, I really wanted to show how the Northern region really kind of looks in comparison to where the other regions are, the other 4 regions are, as well as wanted you to take some time to read some data, and I'm going to explain a little bit more data. When we're looking at the Northern region, the age differential is 5% of population is under 5 years old. 22% is between the ages of 5 and 24 years old, 23% between the ages of 25 to 44 years, 28% between the ages of 45 and 65 years old, and 23% are of 65 and older. In 2022, 20.9% of Nevada's 12 years or older had a substance use disorder exceeding the national average. In 2023, 44.5% of Nevada high school students reported drinking alcohol, although alcohol use rates decreased for both middle and high school students between 2012 and 2023. But as you can see, in 2023, our rate was 44.5%. So this is a picture of the legal counsel's longer summary of AB 60. And once again, kind of following up what Dr. Titus said, a lot of dedicated work and many hours of research and cooperation and collaboration between the Northern Regional Behavioral Health Policy Board, the coalitions, and I do want to say that most of the coalitions are here today representing themselves, so excited to see that they're here, as well as the Nevada Certification Board, community partners, and the BDR subcommittee that was put together by the board, and the guidance of the regional coordinator. This language came out of those conversations and collaborations when it was finally determined that codifying the certified prevention specialist profession and adding the youth peer support language was what the board wanted to focus on for this legislation session. As a board, one of the many priorities that they focused on this past break from the previous session was really looking at Nevada's healthcare and behavioral healthcare shortages. They wanted to look at how their legislation could fill some needed gaps and barriers left relatively untouched throughout the rural and frontier regions when it came to prevention specialists and peer support. Ultimately, looking upstream at prevention, knowing our direct service workforce shortage is daunting, codifying the profession of certified prevention specialists, also known as a CPS, and adding youth peer support language looks at reducing the implementation of non-research prevention programs and focuses on review and oversight to implement best practices and evidence-based prevention programs in Nevada's communities and schools, among other upstream innovation, evidence-based practices and programs, policies, and projects as well. Okay. That said, before we get started on the what and why, I need to inform you that we are requesting 2 mandates of this language as well, though. And they were sent to the committee prior to this hearing, but we're going to take the opportunity to explain and spell them out for you a little bit. So if you have any questions. Amendments. Yes. Sorry. So the first amendment, section 1, chapter 433, redefining the definition of the CPS. Not only do these changes align with the Nevada Certification Board and the International Certification and Reciprocity Consortium, the ICNRC, which is what we really follow when we're doing our certifications. It aligns with the CPS competencies and SAMHSA's strategic prevention framework and guides the foundation, development, and the 3 Ps of prevention to fidelity. As the board and coalitions look at writing the regs and codes upon session closing for the work. So that was kind of what we did with the First Amendment in Section 1, was just redefined certified prevention specialists to really align with the guidelines. And then when we look at Section 7 and 8, they're very similar. Section 7 is what we adhere to right now, due to Section 8 hasn't been implemented yet because the NCB is still going strong and our certification board. And that was really just removing the youth language. All right. And so that's as well, just removing the youth language, everything else is staying the same. All right.
Thank you. For the record, Daria Singer, D-A-R-I-A-S-I-N-G-E-R. I'm an executive director of one of those prevention coalitions, and I'm also a certified prevention specialist. So I don't do the legalese, I don't do the background, we're nonpartisan as well. So I really wanted to talk about what a certified prevention specialist is and what a prevention coalition is. So on the first slide, you will see what the prevention coalitions are in Nevada. There are 10, 2 located down in Clark County, Clark County, if you reference that. And there's actually an 11th being formed in Lincoln County, but they're currently being overseen by Nye Communities Coalition. And then together, collaboratively, we have another organization called the Nevada Statewide Coalition Partnership. And our mission is to be a prevention coalition of coalitions that comprehensively and collectively addresses behavioral health across the state of Nevada to ensure that all Nevada community members have the opportunity to thrive. So next slide. So what is the point of a certified prevention specialist and how that ties into our coalitions? Our role and through our certification, which is one of the most rigorous certifications in the state, is to help procure funding through Department of Health and Human Services, primarily SUPTERS, which is the Substance Use Prevention, Treatment, and Recovery Services Agency, to ensure standardized qualifications that are consistent and of high quality for all members of Nevada, and establish CPSs, or Certified Prevention Specialists, as an official profession within state law, create a framework for accountability, encourage growth as a well-trained prevention workforce, and then also align these professionals with the broader public health structure. As an example, I started at Partnership Douglas County when I was 17 years old, right out of high school, and I've now been the executive director for 3 years, and I've been at the organization for 9. I became a certified prevention specialist after doing my 2,000 hours of direct prevention work. I had 120 training hours in 10 different domains, and now I help supervise other prevention specialists in my community, but also across the state. Also to note, in this room there are 7 other certified prevention specialists, and in the state there's only 36. So a lot of them did show up today to represent and share about the work that we're doing. Next slide. So through that, in the Nevada Statewide Coalition Partnerships and all of the coalitions that are members of that, we have initiatives that we work for, and all of us have certified prevention specialists. So we have helped bring in community health workers through those certified prevention specialists. We do a youth legislative day, and I know last session we even got to meet with Assembly Member Orrin Licker with some of our youth we brought up from across the state. We've done overdose awareness days. We help with the Youth Risk Behavioral Health Survey. We do drug take-back days. We do statewide prevention awareness campaigns. And we do that because through our certification, we are trained in best practice prevention, because we know drug prevention done wrong actually increases drug usage. And with the CPS, or Certified Prevention Specialist, you're also trained to look at the whole person. It's not just saying don't do drugs, drugs aren't good for you, bad things will happen. It's looking at that whole spectrum. What are the environmental factors? What are the family factors? What's the community norms? What are the laws? What can we do to really address health within that person through the lens of preventing them from using substances? And so we'll even take into account sometimes most times socioeconomic factors. Next slide. So for the secondary purpose, it's really to help align the 3 Ps like Sherilyn shared, it's the third bullet point, and that is the evidence-based practices, programs, and policies. And certified prevention specialists are trained to do this. And I'd like to note that this is an international certification, and ICNRC, which is that international board, is looking at codifying this as well at the federal level and making this a federal profession that individuals can move into. So really building up that workforce. I'm not going to read this whole slide, but also the 5th bullet point, there is a quote from ICNRC talking about the importance of having prevention specialists in communities and tying them to certified substance use coalitions such as ourselves.
Sherilyn Rawwood, just for the record. I have a master's in social work, but I decided to take the Certified Prevention Specialist training, the advanced one. It's pretty daunting, I'm not going to lie, the amount of time that you put into the studying and researching, and then the 2,000 hours that you have to give of prevention strategies, utilizing those and implementing them is pretty vast. So I just wanted to share that because I'm going through it right now, and I'm like, you guys, this is kind of, and I just got out of college not too long ago, and I'm like, this is pretty difficult. So I wanted to share that, that the training is really, really focused and not an easy, I don't think, not everybody could do this. Okay, so Cheryl Lynn Marwood for the record. So this is some Nevada revised statutes that are already in place. NRS 388 talks about peer mentoring and prevention in schools for suicide, but no prevention really when it comes to alcohol, to drugs, to that piece of prevention. And so when we looked at the NRS 388 and looked at where's that prevention piece when we're talking about the substance misuse, substance use, alcohol, vaping, violence, bullying, those kind of things. So our thought process was that CPSs can do this type of work for our schools, is go in there and do that prevention piece. So we wanted to add that to there. And then NRS 458 is actually the operation of the coalition that was written into statute last year. So I just wanted to bring those two NRSs and really how we were aligning why to bring this language. And then last but not least, these are prevention specialist legislation around the nation that has passed or that is going through right now. So you can see that New York is working on their regulation right now on enacting prevention specialists, and South Dakota, Oregon, and other states have already enacted this legislation on putting certified prevention specialists into code. And that's our contact information. We are done. We thank you for the time. And we're open for any questions that you might have for us.
Daria Singer for the record. I do want to note that my cell is incorrect on this slide, so it should be 315-7931. And then just one more comment on certified prevention specialists through coalitions. Historically, the substance use prevention coalitions have acted as the lead local agency serving our communities, and we do that through our executive directors and our high-level staff being certified prevention specialists, and really help gearing those programs towards what our community needs, because what Washoe County needs is vastly different than what we need in Douglas County and in Lincoln County. So that is something that we're really excited to hopefully see more of being brought up across the state. Thank you.
Members? Questions? Well, I think you've done it. That's phenomenal. Wow. Thank you. If you don't mind, step back. We will now open up, seeing no questions. For anyone in support of Assembly Bill 60, please come forward at this time. Also in Las Vegas, if you're in the room in support of Assembly Bill 60. Thank you. You may state your name. You have 2 minutes to begin when you're ready.
Thank you, Madam Chair, members of the committee. Blaine Osborne, Nevada Rural Hospital Partners. Still happy to be here, happy to support another good bill, and we appreciate your support. Thank you.
Katie Zeller for the record, Kadiezeller. Halito Sahochifuyak Katie, Fala Nevada Atali. Hi everyone, my name is Katie and I'm an enrolled citizen of the Choctaw Nation of Oklahoma. I am also a member of the second cohort of the Certified Prevention Specialist, and while I no longer work at the coalitions, of which I did for 6 or 7 years, I still work with all of my colleagues and partners to ensure that the things that we're implementing at the different positions that I hold are still at those best practices levels. I do want to specifically focus on the language where we were talking about other culturally relevant interventions. I think it's important to note that we all understand that our Native populations have been historically misunderstood in our data and our representations, and a lot of our cultural practices are prevention methods. And so when we're working with prevention specialists, part of the rigorous training is that cultural humility part, and understanding that it's so essential to have a community member of that identity working with those populations, and the certification continues to bolster that identity and those efforts, making us more competitive for that federal funding. And it also just in general is such an important part of our communities. Like we said, there is one prevention or at least one prevention coalition serving each county, and so knowing that it's not just these minute minimal efforts, it is a statewide effort. Thank you.
Good afternoon, Chair Brown May and members. I appreciate being here. Laura McSwain, MCSWAIN, founder and president with the Water Fairness Coalition. We are in support of what AB 60 under the premise that there is problems to solve in areas that have to do with health and the welfare of our youth, north and south. Our mission seeks to address unfair water policies that and their negative impacts to the community, with health and well-being of people, plants, and animals at the forefront. Clark County schools are being incentivized to remove natural turf on athletic fields and replace them with artificial turf in spite of Clark County Commissioners, Southern Nevada Water Authority, and the Clark County School District Board of Trustees being presented regularly at meetings with scientific reference materials from Mount Sinai Hospital and a variety of PhD credential experts on the dangers of the materials used in artificial turf. The Water Fairness Coalition is dedicated to confronting unreasonable water policies and forced greenery reduction initiatives, including the promotion of the artificial turf as a subsidized alternative to natural turf. SNWA recently applied for and received a $23 million grant from the federal government to provide as an incentive to Clark County School District to complete a $300 million initiative for the conservation of athletic fields at 40 schools with minimal water savings, calling into question SNWA, CCSD, and Las Vegas Valley Water District priorities. What was learned in the 50s about the impacts of lead paint in schools, including reduced IQ points and behavioral issues, serves as an example that illustrates why there should be a proactive approach in identifying and eliminating factors that are detrimental to the long-term health and well-being of our youth. Research shows a correlation between these materials and the increased stress, allergic reactions, turf burns, and other heat and toxicity-related illnesses and injuries. We hope that by adding preventative specialist designation and certification processes, that turf conversions will be reconsidered. Thank you for your time.
Thank you. Is there anyone else here in support of Assembly Bill 60 at this time? Oh, sorry, go right ahead.
Senator Koenig, if you could
You were
get
behind.
shorter,
Yes,
we could-
thank you.
Thank you so much. No, sit up. Good afternoon, Madam Chair and members of the committee. My name is Sarah Adler with Silver State Government Relations, and today I am happy to support AB 60 wearing two hats. First, we represent a client, the Nevada Opioid Treatment Association, and through our work, we know that children who experience ACEs, adverse childhood experiences, are more susceptible to substance use disorder later in their life. And so if we can get highly trained prevention specialists into our schools, we're going upstream, as Sherilyn said, and we have the opportunity to try and prevent greater harm in the future. So that's NODA. My second hat is I'm proud to be a board member of the Healthy Communities Coalition of Lyon County. And we have two all-star staff here, Wendy and Noelle. And we are proud to provide the mental health services through partnership with Lyon County School District. We provide the safe school professionals who range from community health workers to prevention work to social workers. We've had great opportunity in growing our own and working with community health workers and having them go on to become licensed behavioral health providers. We see the same opportunity with a recognition, as this bill does, of certified prevention specialists to do great work on a daily basis and then help grow them, as you see with Daria, as you see with others. So thank you very much for your time.
Thank you. Is there anyone else here in Carson City in support of Assembly Bill 6060? No. Seeing no one moving, no one in Las Vegas. AVH, is there anyone on the telephone lines in support of Assembly Bill 60?
If you would like to testify in support of Assembly Bill 60, please press star 9 now to take your place in the queue.
Good afternoon again. This is Valerie Haskin for the record, VALERIEHASKIN. Thank you, Chair Brown-May, for this opportunity to hear this bill. I'm here to speak on behalf of the Rural Regional Behavioral Health Policy Board, who supports AB 60. In my 6 years in this position, working essentially for the Rural Regional Behavioral Health Policy Board, I've had the opportunity to work with many different groups, but unfortunately I've seen some very well-meaning groups attempting to implement prevention strategies that we now know don't actually work for their intended purposes. So having more sustainable employment options for certified prevention specialists can really help maximize the very few funding dollars that we have available for prevention activities and really start to work upstream. We need to look at prevention as really one of those primary options for ensuring that we are not paying more money and losing more lives and having other negative impacts for our communities later on down the road. Thank you so much for this opportunity.
Chair, there are no other callers to testify in support at this time.
Thank you. At this time, we'll move into opposition. Is there anyone in opposition for Assembly Bill 60 here in Carson City? Seeing no one moving and no one in the room in Las Vegas. AVH, is there anyone on the phone line in opposition for Assembly Bill 60?
Chair, the public line is open and working. There are no callers at this time.
Thank you. At this time, we'll move into neutral testimony. Is anyone here here in neutral for Assembly Bill 60? Please come forward, state and spell your name for the record. You may begin when you're ready. Have you turned your microphone? Thank you.
I apologize. My name is Anna Elizabeth Northen, ANNE-ELIZABETH. Thank you, Mom. And last name is Northen, Northan. I am here as the Executive Director of Join Together Northern Nevada, the Washoe County Substance Misuse Prevention Coalition. Thank you, Madam Chair, and members of the committee for hearing this important bill. I hold a master's degree in public administration and am a certified prevention specialist. The establishment of structured career pathways for substance misuse prevention specialists in Nevada offers a significant opportunity to support a dedicated cadre of public health professionals engaged in one of the most pressing health concerns of our day. The contributions of prevention coalitions have been instrumental in advancing the field in Nevada, and policy initiatives will serve to further solidify and formalize the role of prevention specialists. This aligns with a broader national movement to create defined career trajectories for prevention specialists, underscoring the necessity of subject matter expertise in building community capacity for effective efforts. As the SAPTA Certified Prevention Coalition in Washoe County, Join Together Northern Nevada has been a leader in this domain. I've had the honor of leading this coalition for over 3 years, during which I have witnessed firsthand the profound impact of prevention coalitions and specialists in catalyzing positive community change. Prevention specialists have been integral in spearheading proactive solutions, leveraging collaboration across the 12 community sectors to drive meaningful progress. Through strategic allocation of coalition funding, we've supported initiatives such as capacity building through investment in community-based organizations, fostering culturally competent programs, expanding the prevention workforce, and advancing educational efforts, each of which has contributed to the sustainability and efficacy of our public health initiatives.
You're at 2 minutes. If you don't mind, you'll start to wrap up. Thank you.
Thank you for your time.
Good afternoon, Chair and members. Noelle Chounet, Noelchounet, Healthy Communities Coalition of Lyon and Story County. As someone who has grown up in Lyon County and gone through the prevention program of the 90s, I have experienced firsthand how harmful prevention can be. And when I came to Healthy Communities Coalition and I learned about the certified prevention specialist coming in as someone with a bachelor's in biochemistry, I was like, wow, there's a science behind this. And it's really important. And that drove me to become a certified prevention specialist within my own county and my communities. I now oversee a staff of 17 who directly implement prevention programming across Lyon and Story counties. And we do a little bit in Mineral too. And the impact that those programs have on our youth and our community members is just profound to be able to see it. Today alone, I heard about how the youth are going home with some homework about substance use prevention and engaging with their parents on it and coming back and telling the stories about how great that was to go home with. But initially, our schools, our communities, were not implementing evidence-based practices to the degree that they were. We were bringing in outside community members and organizations. And as a CPS, I'm able to work alongside them to implement evidence-based programs, and we are starting to see that impact. Last fall alone, we educated over 400 students in Lyon County and another 500 students in suicide prevention as well. And we recognize, to what was said earlier, that it is not just substance use, that if you're at increased risk of suicide, if your behavioral health is not at its top, if you do not have enough food in your stomach, you are at more risk of substance use. So being able to address all of those and our staff within the schools and across the county, it's together we are preventing substance use. And I would love to see that I have the possibilities of a professional organization to come together and discuss these best practices, to work together to educate each other and build this program across the state.
Thank you. If you'll start to wrap up, you're over your 2 minutes. Thank you.
Thank you very much.
Good afternoon, Chair and members of the committee. Thank you so much. My name is Jamie Ross, and I am the director of the Nevada Statewide Coalition Partnership, JAM as in mouse, IE, last name Ross, ROSS. And I am part of the originating Certified Prevention Specialist cohort. I wanted to speak a little on the history of our prevention coalitions. Our longest standing prevention coalition in Nevada was founded in 1989. In Las Vegas, I was originally part of one of the newer coalitions founded in 2010. So the history of the coalitions is rich, and it is actually our coalitions and our statewide coalition partnership who helped to create this prevention specialist certification about 8 years ago. And so I'm excited to be a part of hearing towards a professionalization of something that I have had a passion about for about 15 years now. Our certified prevention specialists are the subject matter experts. You have heard this beyond over and over, and wanted to speak beyond just education. We all know that education is important, but without changing our environments, without policy change, without the higher level, community level change, we will not affect the change that we are looking toward. And that is what our certified prevention specialists are able to do. Thank you so much for your time. Have a good day.
Thank you. Is there anyone else here in Carson City in neutral on this bill? Seeing no one in Las Vegas. Is there anyone AVH on the telephone lines in neutral or neutral?
The public line is open and working. There are no callers to testify in neutral at this time.
Thank you, AVH. Senator Titus, you have closing comments.
Thank you, Chair Brown-May. I want to thank the committee for their thoughtful listening. And I want to acknowledge all the folks that showed up today to testify in favor of this important bill. And for me, growing up, I'm not going to say how old I was, but, you know, we were just told, just say no. Or they had that ad out there where they had a frying pan and 2 eggs on it. And now we couldn't afford to do those eggs on that frying pan right now. But just saying no isn't good enough, and we've come a long way to help the youth and the intervention in our state, and we know there's a need, and I so respect all the folks that are in this room today and all the folks that helped put this together, and thank you all for listening to it, and I hope you can support this bill. Thank you very much.
Thank you, Senator. At this time, we'll close the hearing on Assembly Bill 60. Okay, that brings us to the last item on our agenda today, which is public comment. As a reminder, every person has 2 minutes to provide testimony and public comment. Your comments may be submitted to the committee up to 24 hours after the hearing. If there's anyone here in person who is wishing to offer public comment, please come forward to the testimony table at this time. Seeing none, anyone in Las Vegas? I see no movement there. AVH, is there anyone on the telephone line who would like to offer public comment?
The public line is open and working. There are no callers to offer public comment at this time.
Thank you. Members, as we conclude our business today, I have a couple of announcements for you for scheduling. First, our next meeting will take place on Monday, the 24th at our regularly scheduled time, where we have a presentation from Public Health and a bill hearing. And then our schedule on Wednesday, the 26th, is changing to 4:00 p.m., so please mark your calendars. We are looking forward to a joint meeting with our Senate counterparts that will start at 4:00 in the afternoon in room 4100. So that agenda should be posted shortly. Does anyone have any questions or comments before we close today? Okay, with that, we are adjourned.